you do some really interesting work with the World Bank all around the world. Can you share a little bit about the work that you're currently doing, Ben, and what excites you about it?
I made a decision to embark on a major career change about 9 years ago and to work in global health and work on supporting health system strengthening in low and middle income countries. And it was actually something that I wanted to do when I was in university. And I actually set up my graduate studies with that aim. And somehow I got distracted along the way with a lot of other interesting things. I finally got around to coming back to something that was a passion of mine. So in my role at the World Bank, as well as in other assignments that I've done for the WHO or individual governments, I work at a variety of levels. Sometimes it's around helping a government set its broad quality strategy for the health system. Sometimes it's related to helping them figure out what they need to measure in terms of quality in order to monitor the system and provide useful feedback. Or sometimes it's really nitty-gritty. How are you going to improve diabetes and hypertension or hospital patient safety across an entire health system? What are the specific things that you need to be implementing in order to have a much more highly functioning system? Reforming primary care has been a particular focus and an interest of mine. I've been involved in a project called the Primary Healthcare Performance Initiative, aimed at helping countries measure quality consistently in primary care across Africa, Asia, and South America. And I guess the greatest thing about it is the opportunity to explore ways of making a difference. And an order of magnitude that is way different and greater than in Canada, partly because, as I mentioned, we are incredibly lucky with the resources. I mean, we should never, ever take that for granted. But sometimes I feel like in the work that I do, a single project can potentially have a greater impact than the sum of what I may have done in Canada, just simply because the gap between ideal and actual is so enormous for so many people.
And it's an amazing feeling to be doing work that is meaningful. And as you said, you had this passion. You knew you wanted to do this a long time ago. So, when you look back, do you wish you did it sooner? Or are you glad you took the path you took in the different careers and roles?
I'm not sure how to answer that. And because there's advantages and disadvantages. If I had gone that route sooner, I wouldn't have had the opportunity to develop experience and expertise in quality improvement and quality management that I could then share and use in a totally different and new setting. So there are always trade-offs. What's more important is to be aware of what your aspirations are and what would be really interesting and exciting for you, to not let go of something that to not go through life and say, I really wish I went around and did that. But if that feels so strongly about it, why not go for it? And to be open to those opportunities as they come up. And sometimes it's a matter of pursuing the opportunities and making it happen, but it's also a part of the balance is like being able to seize the opportunity when it presents itself to you.
What advice would you give to others, Ben, who are at those crossroads now, trying to figure out what their purpose is, what sort of career is best for them? And as you said, sometimes those voices come back, that repetitive, that aspiration you have. So those are obviously ones you need to tune into. But I'm curious, what would you say?
First of all, this thing about knowing what you want to do when you grow up, I'm not sure I've ever outgrown that. I think I'm always asking that question. And I think that's probably a good thing. It's a great question because I think I count several major career changes, starting off in medicine, but very quickly moving into research in academia and consulting earlier in my career. That was one stream of work. And then jumping headfirst into a leadership stream was another major change. And then later jumping into global health was yet another major change. And when I think the start of some of those journeys, a few things come to mind. One, network like crazy, because that exposes you to different perspectives of what the field that you may potentially be interested in actually looks like, what the day-to-day work actually looks like. It opens the doors to people that may want to take a chance on you and bring you in. And network like crazy, that could be everything, going to meetings, going to conferences, presenting. Social media opens new possibilities, but developing relationships with people in the field that you're interested in is very important. And related to that, finding out mentors. I think that's sometimes we may think that mentorship is something you do early in your career, but it's actually a lifelong process. I'm still seeking out new mentors, different things that I'm doing, either existing or new pursuits, and be sure to pay that back by offering to be a mentor to others. And third, I think I've had some surprises along the way about things that I ended up liking a lot, where if I hadn't tried it or hadn't been exposed to it, I might not have latched onto it as something that was of interest to me. And I've had many experiences. So you can have a plan. It's great to have a plan, but be open to new experiences that may lead you to some new pursuit and a new passion, or your passion may evolve over time, and give yourself the space to explore that.